I'm Dr. Deuk. We're here at Deuk Spine Institute in Melbourne, Florida. And I have one of my patients who came in yesterday from Jacksonville and had back surgery, the Deuk laser disc repair. And where are you headed today?
We're just going back to the hotel. We'll be going back to Jacksonville tomorrow.
Excellent. And how are you feeling today? Day after surgery?
I'm feeling 100% better. Normally right now would be in a 6 or 7 as far as pain. I have 0 pain right now.
Okay. Where was your pain before the surgery?
My pain was across my back, down my hips, and stenosis below my legs, and I have none of those problems.
And you've walked, you told me you were keeping track of how far you've walked so far, and you've walked...
So far, 24 hours, almost exactly out of surgery. I walked 6,000 steps, 2.65 miles in 15 minutes of exercise, and that's without trying or straining myself because I have a bulldog of a wife chasing me.
So since surgery yesterday, you've walked 2.6 miles, right?
Yes.
That's amazing.
She expects that. I'm sorry. I love her very much. Don't worry.
Now, one thing I noticed yesterday in surgery, when we actually got the drapes down far enough, you were laying on your belly at the time, was that you've got a tail coming off your back, a gator tail.
I have a spondylosis, yes.
No, a real gator tail.
Oh,
I heard you're
yes,
a gator
I do.
fan. Is that right?
I have 2 tattoos. They are for whenever they won a national championship in 2006 and 2008. God forbid they ever win another national championship. That was in football. Hell, if I had one for every national championship they won, I have 20 tattoos.
That's right. So you know that's where I trained.
Yes.
Yep. And when I was training in neurosurgery, Steve Spurrier was still there.
Wow.
And they had won a couple of national championships back then too.
Right.
So listen, it's been an honor for me to be able to take care of you, and I'm happy your symptoms are gone. And thank you for coming in and trusting us with your care.
Thank you very much, doctor.
Yes, sir.
And
All
thank
right.
all the